I'm Sarah O'Brien, and I'm a homemaker but also a registered nurse. And I have Finn, who is 5 years old, and Dagan, who's 3 years old. I had experience working with Dr. Sam at the hospital as a nurse, so I got to see her as a doctor, in a different way than maybe most patients would get to see her. So I feel like that was special, and I was lucky to just see how she was behind the scenes, not only when the patients were awake per se. And then when I found out I was pregnant, I was reading a lot about just the high C-section rates and not personalized care, and just a lot of going to these offices where there are many doctors and maybe you choose one, but you see that one not very often because you just kind of see whoever's there and you don't know who's going to end up being there for your delivery. I knew that Dr. Sam had this special personalized care, and I thought, well, let me find out more about it because I respected her so much as a doctor. Right from the beginning, she was really just confident and like relaxed almost with us, and just but very personal with us and not rushed, and just just kind of sat and talked to us and was really just kind of there for us and like went at our pace. And it wasn't, the office staff was really friendly, the waiting room wasn't filled with tons of people, so it was just, the whole experience was inviting and welcoming and like more relaxed, I would say, of a vibe. And it just made us then feel more relaxed and comfortable. And then of course talking to her, we just felt that even more.
Well, it was a breath of fresh air, which is trite, but I really felt like she was trying to connect with us, and she wanted to know who we were before she was going to be our doctor. And I found that very important. She asked a whole bunch of personal questions, not in she wanted to know about us, which I felt like she was then going to give us her full attention based on who we were and what our needs were and our personalities. That to me was a very, very important aspect of why we chose Dr. Sam.
Going back to my experience of being a nurse, and even before I was a nurse, I worked in doctor's offices, and so I kind of know how the telephone game can go just in human nature. So to think that you have a concern and there's potentially this middle person between you and the doctor who isn't knowingly doing anything, to harm the communication. But I just feel like the lines of communication are wide open because it's directly between the patient and the doctor. And in addition to that, it's much more quick to get answers. And you're, I think, less hesitant to ask those questions, any little question. Maybe it seems little to you, but Dr. Sam is so available that I don't hesitate to ask it, because it's not like, oh, I'm inconveniencing or whatnot. I just figure I'll text her when she can, she answers it, and then I have the peace of mind, and everything is set.
But really, all of our friends we've recommended, and we've told exactly what I said to you, which is, if you want the best care possible, it is so it's priceless. I mean, it's, to my mind, it's actually cheap compared to what you're getting. You don't get this kind of service anywhere else. You don't get to be treated like a king and a queen anywhere else. It is 100% worth it. We're now our third time, and we have no qualms about paying for it.